Hello.
Hi,
What's your name?
Melony Teague.
And Melanie, how old are you?
I'm 40 years old.
And describe your injury for me.
As a swimmer, I had a shoulder injury about a year ago.
Yeah.
And depending on how the swimming training is going or how daily life, shopping, groceries, picking up things goes, sometimes that reoccurs.
What was the specific diagnosis?
It was really stress in the muscles. The back muscles were stretched, and so they weren't strong. So I had to do a whole bunch of posture exercises.
Right. And what methods of rehabilitation have you tried in the past?
I had to do physiotherapy exercises, so correcting the posture, that sort of thing. But lately I've been spending a lot of time on the computer.
Yeah.
So working on the computer with the mouse, and that caused more stress.
Now, what kinds of results have you seen from physio, the rest of the methods of rehabilitation?
Physio is a long process. You have to keep up with all the exercises every week.
Right.
And then you do see an improvement.
Right.
But it took a good 6 months of therapy to improve.
So if you had to quantify the improvement from when you got injured to 6 months down the line, what percentage would you say it was?
I had a really good physiotherapist who was a really specialist in the area, so
Fantastic.
I had 100%.
Excellent. And then you still had pain remaining after that?
Every now, depending on if I would do something and injure myself, or swimming training and there was a sprint and I would push it too hard, then it would come back.
Right.
But most of the time it was okay.
How would you describe Trigenics?
Trigenics is great because you don't have a bunch of exercises you have to do in between, because it's pretty much instant results.
Now, what do you think it is? How would you describe it? Is it manual therapy? Is it exercises? How would you describe it?
Trigenics?
Yes.
Well, it's really a gentle thing, which is what has surprised me the most.
Yeah.
Often when you go for physiotherapy, you end up coming out bruised. You feel bruised and battered because you know the pressure points have been dealt with, but this is really gentle, and it helped with breathing, which is also beneficial. And I guess a lot of shoulder issues to do with stress and being stressed, and I guess the breathing helps relax that. And not only that, you could feel the sensations as you're treating it. You know, you could feel those electrical little things going on, and you could feel it right away. And sometimes if you would be pressing here, I could feel it in my elbow, so I could tell exactly where it was working on.
Right. What are the specific benefits you've noticed from Trigenics?
Well, I noticed that it was a pretty quick recovery, not immediate, like right then, but within the 24 hours following, like 80% improvement.
Yeah, great. Now, and what's interesting was a week later we talked again. How did the improvements hold?
Well, it was still 80%. Nothing regressed. It didn't come back. It was still pretty good.
Perfect. And we just did one more treatment a few minutes ago. How do you feel now?
Well, my flexibility is great, and the strength is still there, and I'm very, very symmetrical now, whereas a week ago there was a definite imbalance.
Yeah, right to left.
Yeah.
Perfect. Now, what advice would you give to someone else?
I would say try it. It's great because it's probably treating areas that are often overlooked, and it's a gentle procedure. It's nothing that's, if you're worried, if you're somebody that's worried about chiropractic or anything like that because you worry about manipulation, then this is great because it does treat you, and you're not going to be worried about feeling sore afterwards or anything like that.
Thank you very much.